Okay, hi everyone, welcome back to my channel. Today I come up with obstetric and gynecology question which prepare you for exit and the COC exam. So don't forget to encourage me by subscribing my channels. Now I am going to directly to the question. Question number 1. All of the following are true. All of the following are true about severe polyhydramnios, except A. It is diagnosed when the single vertical pockets of amniotic fluid exceed 8 cm. B. It is usually due to severe fetal malformation. C. It can be managed by amniocentesis. D. It can carry risks of cord compression. Please try to guess it for 5 seconds. If you said D, you have got it, because severe polyhydramnios carry the risks of cord prolapse rather than cord compression. So the answer is D. The risks of cord compression is most commonly occur with oligohydramnios rather than polyhydramnios. The next question, which of the following is false about asymmetric intrauterine growth restriction? Asymmetric IUGR. A. It usually occurs in the last phase. B. The chromosome abnormality is the most common cause. C. Placenta insufficiency is the most common cause. D. It mainly affects the cell size than cell number. Think over it for 5 seconds. If your answer is B, you have got it. Because the chromosomal abnormality is most commonly occur with symmetrical IUGR rather than asymmetrical IUGR. Symmetrical IUGR. The next question, question number 3. This is the scenario. Let me read it for you. A 25-year-old mother was admitted in second stage of labor and delivered to her second baby by spontaneous vaginal delivery. Upon reviewing her chart, her blood group and RH is A negative and that of her husband is A positive. She took anti-D during her previous delivery and the indirect competence is negative. The blood group and RH of the baby is O positive. Which one of the following is true about the case? A. It is impossible to have O positive baby if both parents are A blood type. B. No need for anti-D as she received it and immunized during her previous delivery. C. ABO incompatibility in the case is a protective for RH isoimmunization. D. It is possible to have O positive baby if both parents are A blood types. Think over it for 5 seconds. If you said C and D, you have got. Because ABO incompatibility can lead to rapid destruction of fetal red blood cell. You know that. Before the mother's immune system reacts to the RH antigen. This results in reducing a risk of RH sensitization. And the second one is 2 A blood types of the parent can have O positive child if both carries or LLS. So the answer is C and D. Question number 4. The most definitive principal management of eclampsia is A. Delivery. B. Drug management. C. Control of conversion. D. Mechanical management. Think over it for 5 seconds. If you said A, you have got it. Because you know that the definite management of eclampsia is delivery, because it will remove a source of condition. The drug management and conversion control are supportive measures, but do not the curative management for eclampsia. Question number 5. Which one of the following is not a dysmaturity syndrome of the baby? A. Failure of fetal growth. B. Loss of subcutaneous tissue. C. Wrinkled skin. D. Clear amniotic fluid. Think over it for 5 seconds. If your answer is D, you definitely have got it. Because dysmaturity infant typically have meconium stained amniotic fluid. It is not clear. It is not clear fluid. The other option are future or post-mature syndrome infants. Post-mature syndrome infants. Question number 6. The accurate diagnosis of postpartum pregnancy is made by accurate dating except A. Positive pregnancy test by 6 weeks from last normal menstrual period. B. By manual examination is in the second trimester. C. Fetal health at 20 weeks by fetoscope. D. Confirmatory by ultrasound period to 26 of gestational age. Please try to get the answer within 5 seconds. If you said B, you have got it. Because by manual examination in second trimester is not reliable for accurate dating. Because ultrasound before 26 weeks is the most accurate method. Almost in the early pregnancy, ultrasound is the best one, and also there is a positive pregnancy test. And fetal as this one is all are what the accurate, almost it is relatively the accurate diagnosis, but the bimanual examination second trimester is not the accurate diagnosis for postpartum pregnancy. Question number 7. Which one of the following is not true about determination of zygosity? Not true about determination of zygosity. A. Twin transfusion is almost the common in diagnostic twins. B. Twins of opposite sex are almost always dizygotic. C. Monochorionic placentation indicates monozygosity. D. Dichorionic twins of similar sex may be dizygotic or monozygotic. Think over it for 5 seconds. The answer is A. Because twin transfusion syndrome occur only in monozygotic twins, which are always monozygotic. Dizygotic twins have a separate placenta and never monochorionic, and it is separate placentas. Separate the placenta. Question number 8. All are the indication of cesarean section for retained second twins, except A. Fetal microsomia. B. Surface retraction, not dilating. C. Hypotonic uterine dysfunction. D. Borderline of fetal heart sound. Please try to guess the answer within 5 seconds. You said D, you have got it. Because the borderline of fetal heartbeat is not an indication for cesarean section. Cesarean section, unless there are other signs of fetal distress. If there is no other the other signs, the only borderline of fetal sound, no only the indication of cesarean section. The next question. The following are a prerequisite for trial of skull vaginal birth after cesarean section, except A. Clinically adequate pelvis, B. Estimated fetal weight less than 4 kg, C. Previous successful vaginal delivery, D. Facility for managing rupture, E. Maternal consent. Maternal consent. I already answered the question. Sorry. The answer is C. Because the previous successful vaginal delivery is favorable by the way, but not a prerequisite for VBAC. It is not favorable for prerequisite for VBAC. The other conditions are necessary to ensure the maternal fetal safety. The next question. All of the following are the components of active management of surface labor, except. My question almost is not and except is. Question multiple choice A. The international unit of oxytocin IM or ergometry 2 mg IM or IV. B. CCT with each contraction. C. CCT when there is sign of placenta separation. D. Uterine massage. Think of it for 5 seconds. You said B, you have got it, because the controlled contraction is done only after sign of placenta separation, not with each contraction. The next question. Failed vacuum is considered in all except A. Failure to descend with each pull, B. More than 2 poop off, C. Maternal refusal for application, D. Failure to deliver after half of an hour of application. Think of it for 5 seconds. If you said C, you have got it, because the maternal refusal is not contraindication for vacuum delivery, not a criterion for failed vacuum. The other option indicates the failure of the procedure. The next question. The following are the maternal complications of twin pregnancy, except A. Anemia, B. Polyhydramnios, C. Hypertensive disorder, D. Postpartum pregnancy. Please try to guess the answer within 5 seconds. You said D, you have got it, because twin pregnancy are more likely to result in preterm labor rather than postpartum pregnancy due to uterine overdistension. The other complications are commonly associated with twin pregnancies. So the answer is D. Question number 13. Which one of the following is not true about dizygotic twins? A. They are the result of 2 separate fertilization. B. They are always have 2 placenta. C. They are always have the same sex. D. They can have different blood types. Think over it for 5 seconds. If you said C, you have got it, because dizygotic twins can be of the same or different sexes. as a result from fertilization. Question number 14. The most common cause of postpartum hemorrhage is A. Uterine atony, B. Retained placenta, C. genital tract trauma, D. coagulopathy. Think over it for 5 seconds. If you said A, you have got it, because uterine atony is the failure of uterus to contract effectively after delivery. You know that, because it is this uterine atony is the most common cause of postpartum, the postpartum hemorrhage. The most common one is what? Uterine atony. The next question: a woman with history of cesarean section is in labor. Which one of the following contraindication for trial of labor after cesarean section or TOLAC? A. Previous low transverse cesarean section. B. Clinically adequate pelvis. C. Previous classical cesarean section. D. No other uterine scar or rupture. Think over it for 5 seconds. If you said C, you have got it, because a previous classical or vertical uterine incision has a higher risk of uterine rupture, making TOLAC is contraindication. The next question: should the dystocia commonly associated with all except A. fetal microsomia, B. diabetes mellitus, C. postpartum pregnancy, D. preterm delivery? The answer is D. I already answered it, because the shoulder dystocia is typically associated with larger babies, which are the more common in microsomia, diabetes, and postpartum pregnancy. It is not commonly associated with preterm deliveries. So the answer is D. The next question: which one of the following is not a risk factor for ectopic pregnancy? A. pelvic inflammatory disease, B. previous ectopic pregnancy, C. use of intrauterine device, D. multiparity. Think over it for 5 seconds. If you said D, you have got it, because multiparity is not a risk factor for ectopic pregnancy, not a risk factor. The other option, you know that, pelvic inflammatory disease, previous ectopic pregnancy, and use of intrauterine devices, the risk factor for ectopic pregnancy, but multiparity is not a risk factor. The next question number 18: in placenta previa, the most common presenting symptom is A. abdominal pain, B. painless vaginal delivery, C. fetal distress, D. uterine tenderness. Please try to guess the answer within 5 seconds. You said B, you have got it, because placental previa typically present with the painless vaginal bleeding in third trimester due to the placental tissue near or covering the cervical os. It is covering the cervical os, so it is the painless vaginal bleeding is the most common presenting symptoms. The next question, number 19: which of the following is the contraindication for the use of methotrexate in ectopic pregnancy? A. hemodynamically stable patient, B. no fetal cardiac activity, C. renal dysfunction, D. ectopic mass size less than 3.5 centimeters. Please try to guess the answer within 5 seconds. You said C, you have got it, because methotrexate is the contraindication in the patient with a renal dysfunction because it is primarily excreted by kidney and can be toxic if not cleared properly. This methotrexate is toxic if it is not cleared properly. So the answer is renal dysfunction. Renal dysfunction is the contraindication for methotrexate. Question number 20. Question number 20. The best method for confirming diagnosis of ectopic pregnancy is A. Uterine pregnancy test, B. Serum beta HCG measurement, C. Transvaginal ultrasound, D. Abdominal ultrasound. Think over it for 5 seconds. If you said C, you have got it, because transvaginal ultrasound is the most accurate method for diagnosing the ectopic pregnancy, because it provides a clear view of the pelvic structure. Okay, all of the following are the sign of magnesium sulfate toxicity except A. Decreased deep tender reflex, B. Respiratory depression, C. Hypotension, D. Seizures. Think over it for 5 seconds. If you said D, you have got it, because seizure as a sign of eclampsia, not a magnesium sulfate toxicity. You know that magnesium sulfate toxicity is typically presents with respiratory depression, loss of reflexes, and hypotension, rather than seizures. So the answer is what? D. The next question. The most appropriate management for cord prolapse is A. Immediate oxytocin administration, B. Elevate the presenting part and emergency resection, C. Allow for spontaneous vaginal delivery, D. Artificial rupture of membranes. Think over it for 5 seconds. You said B, you have got it, because cord prolapse is an obstetric emergency requiring elevation of presenting part to relieve pressure on the cord and an immediate cesarean delivery to prevent fetal hypoxia. Okay, the next question. Which one of the following is a sign of uterine rupture? A. Gradual onset of abdominal pain, B. Loss of fetal station, C. Steady of fetal heart rate, D. Increased uterine tone. Think over it for 5 seconds. If you said B, you have got it, because loss of fetal station or the fetus move back in the pelvis is the key sign of uterine rupture. This is due to fetus escaping into the abdominal cavity from uterus. The fetus is escaping from what? From the uterus to what? The abdominal cavity. This results in loss of fetal station. Loss of fetal station is the sign of uterine rupture. The next question. The most common cause of maternal mortality worldwide. A. Hypertensive disorder, B. Hemorrhage, C. Sepsis, D. Embolism. Think over it for 5 seconds. You said B, you have got it, because postpartum hemorrhage is still the leading cause of maternal mortality globally, particularly in low-resource settings due to inadequate access to healthcare and blood transfusion services. Next question: which of the following is the contraindication for vaginal delivery? The contraindication for vaginal delivery: A. Cephalic presentation. B. Previous spontaneous abortion. C. Preterm labor. D. Placenta previa. Think over it for 5 seconds. If said B, you have got. Because in placenta previa, the placenta obstruction the cervical opening. This results in making vaginal delivery hazardous due to risks of severe hemorrhages. The next question: which medication is used to enhance fetal lung maturity in preterm labor? A. Magnesium sulfate. B. Terbutaline. C. Betamethasone. D. Indomethacin. Think over it for 5 seconds. If said C, you have got it, because betamethasone is the corticosteroid given to accelerate fetal lung maturity and reduce neonatal respiratory distress syndrome in preterm births. The next question is: the definite management for eclampsia is A. Antihypertension therapy. B. Magnesium sulfate. C. Delivery of the fetus. D. Bed rest. I already asked this question. I repeated it. The answer is C. You know that answer. The next question: a pregnant woman with pruritus and jaundice and elevated bile acid likely has A. acute fatty liver of pregnancy. B. intrahepatic cholestasis of the pregnancy. C. preeclampsia. D. hyperemesis gravidarum. If you said B, you have got it, because intrahepatic cholestasis of the pregnancy characterized by itching or pruritus, jaundice, and elevated serum bile acids. This is typically especially in third trimester pregnancy. This sign is almost visible. The next question: the Bishop score is used to A. assess fetal well-being. B. diagnose preterm labor. C. evaluate cervical readiness for labor. D. measure uterine contractions. You said C, you have got the answer, because the Bishop score assesses a cervical favorability and readiness for labor induction. This results in dilatation, effacement, station consistency, and the position of the cervix. The next question: which of the following is the most common cause of oligohydramnios? A. fetal renal agenesis. B. preterm labor. C. maternal diabetes. D. multiple gestation. Think over it for 5 seconds. If said A, you have got it, because the fetal renal agenesis, or what we call it in other medical term, the absence of. The next question: The most common cause of postpartum fever is A. Endometritis, B. Eclampsia, C. Preeclampsia, D. Placenta previa. Think over it for 5 seconds. If you said A, you have got it, because postpartum endometritis is the infection of uterine lining, commonly cause fever and the abdominal pain after childbirth. The next question: which test is most appropriate for diagnosis of gestational diabetes? A. Random blood sugar, B. Hemoglobin A1C, C. Oral glucose tolerance test, D. Urine glucose test. Think over it for 5 seconds. You said C, you have got it, because oral glucose tolerance test is the gold standard for diagnosis of gestational diabetes, which is typically performed between 24 to 28 weeks of gestation. The next question: polydramnios is most commonly associated with A. fetal growth restriction, B. maternal hypertension, C. gastrointestinal obstruction in the fetus, D. oligodramnios. Think over it for 5 seconds. C is the answer, because excessive amniotic fluid is commonly associated with fetal gastrointestinal obstruction, or what we call it esophageal atresia, that prevent normal swellings of amniotic fluids. The next question: the most reliable method of confirming preterm premature rupture of membrane is A. nitrazine test, B. ultrasound, C. Ferning test, D. digital vaginal examination. Please try to get the answer within 5 seconds. You said C, you have got the answer, because the Ferning test, which shows the characteristics of Fern patterns of amniotic fluid under the microscope, because it is the most reliable confirmation of premature rupture of the membrane, The next question: which of the following is the first line management for severe preeclampsia? A. fluid restriction, B. management of sulfate for seizure prophylaxis, C. immediate induction of labor regardless of gestational age, D. bed rest only. Think over it for 5 seconds. If you said B, you have got it, because magnesium sulfate is administered to prevent seizure in severe preeclampsia, followed by timely delivery depending on fetal and maternal status. The next question: the most common cause of maternal death in eclampsia is A. stroke, B. renal failure, C. pulmonary edema, D. sepsis. Think over it for 5 seconds. If you said A, you have got it, because stroke is due to severe hypertension and intracranial hemorrhage. Okay, the next question. The preferred method of contraception for lactating mother is A. COP, B. copper IUCD, C. progestin only pills, D. condom. Please think over it for 5 seconds. You said B, you have got it. Because progestin only pills are safe for breastfeeding, because it don't affect milk supply, unlike combined oral contraceptive containing, unlike a COP, because it can contain estrogens. The next question: the most common cause of neonatal respiratory distress syndrome is A. prematurity, B. congenital pneumonia, C. meconium aspiration, D. diaphragmatic hernia. Think over it for 5 seconds. You said A, you have got it. Because prematurity infants are at the high risks for neonatal respiratory syndrome due to underdeveloped lung and insufficient lung surfactants production. This is the reason behind. In prematurity, there are high risks of respiratory distress syndrome due to underdeveloped lung, and as well as there is insufficient surfactant production in the lung. This results in respiratory distress syndrome. The next question: the best initial management for shoulder dystocia is A. cesarean section, B. MC Roberts maneuver, C. fundal pressure, D. episiotomy. Please try to guess the answer within 5 seconds. You said C, B, you have got it. Because MC Robert maneuver is the maneuver which involves hyperflexing of maternal leg to her abdomen, which helps to widen the pelvis and straighten the sacrum. This results in relieving for shoulder dystocia. This is the best management is MC Robert maneuvers. The next question: which hormone is responsible for maintaining the pregnancy by supporting the endometrium? A. Estrogen, B. oxytocin, C. prolactin, D. progesterone. Think over it for 5 seconds. You said D, you have got it. Because progesterone, you know that it maintains the uterine lining and also preventing the menstruation and also supporting embryo during early pregnancies. The next question: this is scenario, 35 years old woman presenting with postcoital bleeding. The next step in the management is A. observation and reassurance, B. pap smear, C. endometrial biopsy, D. hormonal therapy. Think over it for 5 seconds. The answer is B. Because postcoital bleeding guarantees evaluation for cervical pathology, including cervical cancer, and a pap smear is the first diagnostic step. You know that. The next question: which of the following is a risk factor for ectopic pregnancy? A. Polycystic ovarian syndrome. B. Pelvic inflammatory disease. C. Endometriosis. D. Ovarian cysts. Think over it for 5 seconds. The answer is B. Because pelvic inflammatory disease can cause tubal scarring, which result in increasing the risk of ectopic pregnancy. The most common one is PID. The next question, this is the scenario. This exam I took the comprehensive when I was undergraduate. Let me read it for you. Whether X comes to your hospital with a complaint of vomiting for 5 days with gestational age of 10 weeks. The blood pressure is 90/50 millimeter mercury and a pulse rate 110 beats per minute and the temperature is at 7.5 degrees Celsius. Vomiting of every ingested matter, weight loss, dry tongue, and sunken eyeballs. What is the most likely diagnosis for this patient? A. Mild disorder of pregnancy. B. Nausea and vomiting. C. Hyperemesis gravidarum. D. Dyspepsia. Think over it for 5 seconds. It said C. You have got it because hyperemesis gravidarum is characterized by severe persistent nausea and vomiting leading to dehydration. There is also electrolyte imbalance, weight loss, and the sign of hypovolemia such as low blood pressure and tachycardia is the most common sign and symptom of hyperemesis gravidarum. From this scenario, you can get this sign and symptom. So the answer is C. The next question, which of the following is not used to confirm fetal lung maturity? A. Phosphatidylglycerol. B. Chorionic villus sampling. C. Surfactant albumin ratio. D. Lamar body count. Think over it for 5 seconds. You said B, you have got it, because chorionic villus sampling is used to genetic testing in early pregnancy rather than for assessing fetal lung maturity, because fetal lung maturity is typically evaluated by using those options: laminar body count, surfactant albumin ratio, phosphatidylglycerol. So the next question, a prima gravida lady comes to your hospital and her VDRL is positive. Which of the following is a preferable regimen for her treatment? A. Amoxicillin. B. Byzantine penicillin. C. Ampicillin. D. cloxacillin. The answer is B, because Byzantine penicillin is a drug of choice for syphilis during pregnancy, because it is effective across the placenta and prevent congenital syphilis, malformation related with syphilis. The next question. A midwife is caring at a rural health center. Which of the following can be used to early identify IGR? A. Serial fundal measurement. B. Ultrasound. C. Femoral length to abdominal circumference ratio. D. Head circumference to abdominal circumference ratio. Think over it for 5 seconds. You said A, you have got it, because At rural health center, there is no ultrasound. So the easiest method to identify IOGR is the serial fundal measurements. The next question, on abdominal examination, the midwife finds the hard, round, and palatable mass in the fundus. So what's the presentation? So if you get this is the palatable and round and hard mass at the fundus, so the presentation is what's the presentation of the presenting part? Think over it for 5 seconds. You said A, you have got it, because if you get the hard, round, and palatable mass in the fundus during abdominal examination on the fundus, by default there is a presentation. The buttock is what? On the lower uterine segment, on the in the breech presentation. The presenting part is a breech. The next question, when the part of the fetus between the orbital ridge and interfontanelles presents, what is the presenting parts? What the presentation? Think over it for 5 seconds. You said C, you have got it, because in broad presentation the area between the orbital ridge and interfontanelles is the presenting part, which is leading to a larger presenting diameter and a possible delivery complication. The next question, which of the following is not a tocolytic drug? A, indomethacin, B, salbutamol, C, magnesium sulfate, D, dexamethasone. Think over it for 5 seconds. You said D, you have got it, because dexamethasone is a corticosteroid. It's used to enhance the fetal lung maturity. It is not a tocolytic agent. The tocolytic like magnesium sulfate, indomethacin, salbutamol is used to delay the preterm labor. The next question, the drug of choice for prevention and treatment to convulsion in intrapartum is A, diazepam, B, magnesium sulfate, C, adrenaline, D, labetalol. Think over it for 5 seconds. If you said B, you have got it, because magnesium sulfate is the first line medication for preventing and treating eclamptic seizure. Due to the magnesium sulfate its mechanism of action is on the central nervous system. It is depressant effect, so it is result in obstructing a normal embryo transporters. So the answer is B. Thank you very much for listening to me, for your person.